Imagine brushing your hair and just finding too many strands in that brush. Or your hair is falling out in clumps. Yes, hair loss can be cosmetic, but it can also be a sign of something deeper. Today, we're diving into how hair loss could be your body's first cry for help with an autoimmune disease. Hair loss could be your body's unique red flag that something is wrong. The immune system can fight anywhere. Autoimmune disease can be anywhere. It can attack the lungs, the skin, the heart, the eyes, the brain, but also the hair. And hair follicles are particularly vulnerable when the immune system misfires. So yes, inflammation can be associated with hair loss. Today, we're going to talk about which autoimmune conditions are associated with hair loss. Number 2, what are we going to do about that hair loss and how do we stop it? And number 3, can we reverse that hair loss? Spoiler alert, we actually can reverse it in many cases and improve it in others. Let's get started. Autoimmune disease, though, can be tough to diagnose. Carla, a 33-year-old woman, was sent to me by her primary care doctor for an abnormal blood test. But when I talked to her, what really bothered her was the immense hair loss. Overall, she actually felt pretty good, but she was also an athlete, a long-distance runner, and would run 7 to 10 miles on Saturdays and Sundays and was very athletic during the week. When I asked her more questions though, she was still running but only at 5 miles, which is still pretty good, but for her was a change. A few months ago, she told me she had COVID, and since then, she hasn't been really able to run as much as she used to. On top of that, it takes her hours to get ready in the morning, and it's not from putting on makeup. It's because it's really tough to kind of get going and move, and she just felt like she was much older than 33. So I was starting to get suspicious, and so we started the workup. And I'll tell you what happened to Carla, but first let's talk about different conditions that are associated with hair loss. Alopecia areata is the second most common alopecia out there after female pattern and male pattern baldness, and it can affect up to 2% of the population worldwide. Now, it tends to happen to younger people. It can be any age, but oftentimes many people are diagnosed even by the time they're in their 30s. Sometimes it's mild, it can go away on its own, and other times it can be permanent. It can affect the entire body or just certain areas. While it's not life-threatening, it can certainly cause devastating consequences mentally, psychosocially, and affect your life in so many different ways. Usually it's not associated with necessarily other symptoms, so it could be that the only symptom you have is that hair loss. But many other conditions like rheumatoid arthritis, lupus, psoriatic arthritis, they have other features. For example, if you're suddenly starting to get fatigued, you just can't wake up well in the morning, you're depressed, things just don't feel right, you have new rashes, your joints may hurt. These are all more systemic features, right? It's not just the hair. That's when you would think to yourself, is there something else going wrong? Could this be an autoimmune disease because of all these other features? Now, conditions like rheumatoid arthritis aren't as associated with hair loss aside from when you have a flare or maybe the medications themselves, but we'll get to that. Lupus, on the other hand, almost 50% of people with lupus will have hair loss at some point in their journey. It's tough enough to deal with lupus, let alone the hair loss that comes with it. Now, the good news is that oftentimes it can be treated. There's multiple different types. There can be scarring alopecia or non-scarring alopecia. When you have that diffuse hair thinning of lupus, it's a good time to get evaluated because you might have active disease. And if that can be targeted and the immune system can kind of calm down, oftentimes a lot of that is reversible. However, if you have scarring alopecia, like you have areas or spots where you have this shiny skin, it could be raised, especially these circular patches, that's a little bit harder to tackle. Once it scars, that hair generally doesn't tend to come back. But while it's still in that acute phase, maybe it's still a little bit red, that's the time you want to get in. Oftentimes, even corticosteroid injections into the scalp, that can kind of slow down the process, or getting on different medications. Some of the newest medications out there for lupus really can help with the hair loss. What about Crohn's disease and ulcerative colitis? Well, those conditions can be associated with hair loss, especially because there are conditions of malabsorption, right? Your gut is not absorbing the nutrients that it should be. And because of that, you're not having enough iron, B12, vitamin D, all those other good vitamins in your body. And that could be reflected in your hair. What about Hashimoto's thyroiditis, thyroid condition, where your immune system is attacking the thyroid? It's actually fairly common and can be associated again with fatigue, depression, just not feeling well, sluggish, weight gain. You can sometimes feel your thyroid being a little larger, not always. And it has a unique pattern of hair loss. It could be the outside part of your eyebrows and along the scalp, but also hair thinning. Now that might be a little bit easier to tackle sometimes because you can take thyroid hormone replacement. And once you get in level, oftentimes that improves a lot. And for some people, completely. How about psoriasis? Psoriasis is a skin condition. It's an autoimmune condition of the skin, and you get these red raised patches, sometimes in the elbows, the knees, different parts of the body, but it can also affect your scalp. So I treat psoriatic arthritis, and what do you generally have if you have psoriatic arthritis? It's psoriasis. And we always hope that the medication that we use to target the arthritis will help the skin, but it isn't always the case. And one of the toughest areas to treat with psoriasis is the scalp. There's all kinds of shampoos out there, specialty creams, but the scalp can be really tough, and that thick plaque that forms there often causes hair loss. But there are lots of new medications, and they can be really helpful, like completely change your world around. So it's definitely worth seeking help just to find out if you're a candidate for some of those treatments. This all brings us to how do we solve this problem of hair loss if you have an autoimmune disease? Well, if it's an active autoimmune condition, you need the immune system to calm down. Oftentimes, if you treat the condition, the other symptoms can get better. So there's different types of medications out there, disease-modifying medications, biologic medications, even steroids, which can help. Although I want to point out that steroids can also cause hair loss. So yes, it can improve the disease activity, the immune system dysfunctioning, but it can also cause hair loss, especially like large amounts of it. Now, alopecia areata, there are some treatments for it, including topical creams, but also now there's medications out like oral pills that you can take that can really improve the hair growth. A few years ago, when the medications first started coming out, we were using those same medications in rheumatology for joint pain. And it was really interesting when the dermatologist would come by and be like, hey, can we try some of those samples? Because we're noticing that it's growing hair in some of our patients. And we were always happy to give it because anybody with hair loss knows how devastating it can be. And now they are officially approved for hair regrowth from alopecia. Other things to consider. Okay, well, a lot of these conditions can cause anemia. For example, if you have active rheumatoid arthritis, active lupus, you can certainly get an anemia. Now, you can't always see this on a CBC. That's a blood test that your doctor often checks. However, it doesn't include the iron panel in it. So if hair loss is prominent, it's not going away, it may be reasonable to get an iron panel and check for not only the iron levels, but the ferritin levels, because oftentimes you need almost up to 70 to have a decent head of hair. And these conditions, because of the inflammation, can reduce these levels. Okay, what about nutrition? Well, it's best if you can follow an anti-inflammatory diet, but not just anti-inflammatory. You want to have nutrient-rich. And if you cannot get it in the diet, make sure your supplementation is good if you're losing it elsewhere. And oftentimes that's easy to tell with a blood test. For example, your B12 levels. You want to keep that in level, if not in the middle or higher end of the normal range. That can help. But also vitamin D has been associated with hair thinning, hair loss. So you want to keep those levels good as well. Protein in your diet can be helpful because protein is needed for different muscle functions, tissue functions. And you can imagine if your immune system is fighting in other places, it's going to go and fight in the very important areas and maybe not get that nutrition to your hair follicles. So you have to look at all of these other areas. Now, what if you've optimized your iron panel, your nutrition, you've checked your thyroid, your vitamin D, everything looks perfect? Are there other things that you can do? Yes, there's lots of different treatments out there, from minoxidil to PRP injections of the scalp, and you need a practitioner for that. You can do scalp massages to improve the circulation, and there are also other supplements out there that could be helpful. But overall, if it's from an autoimmune disease, you have to look at that condition itself, and especially at the medications that you're taking. So one of the medications that we prescribe a lot of, it's called methotrexate. Now, a lot of people think this is associated with hair loss, and it can be, but actually only in about 1 to 3% of the population. So it's not really that high. And what we've seen is that it can be very dose dependent. For example, if you're taking a small to moderate dose, many times there's no effect on the hair. Even at the moderate dose, there's no effect on the hair. But if you get to the super high dose, then a lot of people can have hair loss then. And if you just bring it back down to the moderate dose where you weren't losing hair, then you can do much better. You may need to add on a different medication with it and see kind of what works out for you. But it may be that you don't need to get rid of the entire drug. Look at the dose, look at the amount, and see if you can fix that with your physician or your practitioner. Another medication called leflunomide, which is kind of a sister drug of methotrexate, can also cause hair loss, actually much more than methotrexate. Now, in these medications, you can also take folic acid, which kind of helps with the hair. You can take supplements of biotin, but just be careful with that because it can affect your lab tests, especially your thyroid. So you may want to let your doctor know if you're taking that as a supplement. But something else to remember is that especially with patchy hair loss or circular areas, discoid areas with lupus or other conditions, you can get corticosteroid injections into the scalp. and those can be really effective. Only really works when it's fresh, new, it just happened. It's not gonna work 8 years later to kind of stimulate that hair growth. Remember, even if you've had an autoimmune disease for years, the level of inflammation in your body can fluctuate. Whether it's stress, the medications being changed, or just a disease itself progressing, it can affect your hair. And don't forget about the stress-hair connection. When you have more stress, cortisol goes up, and that can also influence your hair follicles. With the stress response, something important to remember though is that you may have that active stressful event, whether it's a severe viral illness or the onset of an autoimmune disease. It can reflect in your hair 3 to 4 months later. So it may have happened in July, but then it's not until September, October that you're all of a sudden starting to notice this hair loss, and you're like, what is happening right now? But it actually, that could have happened. That impact to your body could have happened several months ago. It can be very scary when it happens because you can get this big shed, but hopefully that improves as you are feeling better. So what happened to Carla? She was our 33-year-old who was sent over for an abnormal blood test, but really what I found on exam was a lot of hair loss. And after I examined her fully, there was a rash on her arms. It wasn't terrible, but it was there, and it looked like it could be an autoimmune disease. We had more blood tests done. We ended up diagnosing her with a connective tissue disease. Different conditions under that umbrella are lupus, Sjogren's disease, myositis, and a few others. So she had kind of a combination. We did give her medication, an oral pill, and it did take 6 months, but her hair grew back. And more importantly, she was back to running and feels pretty good. So it can improve with the right treatment. So yes, inflammation can cause hair loss. If you suspect that you have an autoimmune disease that could be causing it, it would be a good idea to get seen sooner rather than later, because that's when you can make the changes. If it's been going on a long time, it's really tough. You can start with a dermatologist who can look at the hair follicles and see what the cause is of the breakage or if there's inflammation at the scalp. Dealing with hair loss from an autoimmune disease can be really tough. But just remember, there are treatments. You may need some medical tweaks, but there's a lot that can be done to improve the hair loss. Inflammation can affect so many different parts of the body, but there are strategies you can use to help reduce it. Aside from medications, there are lifestyle measures that we can pursue, such as food. If you want to know more about anti-inflammatory diets and foods, you can look at this video next. If you've had any challenges with this, then please drop a comment, and I'll see you next time. Plant Forward MD.